Hi, I'm Lila. I did my model over the cardiovascular system. I made it with cake and Twizzlers. It's a giant cake pop heart, and I kind of modeled it as if I would model clay. We're going to start with the pathway of blood. First, we have blood coming in through the veins of the body. It's going to come in through the inferior and superior vena cava. It's going to come into the right atrium, be pumped through the tricuspid valve up through the right ventricle. Then after that, it's going to go through the pulmonary valve, which is under this aorta. It's that blue one right there to simulate deoxygenated blood. It's going to go through the pulmonary arteries to the lungs, where it's going to become oxygenated, come back through the pulmonary veins, and then it's going to go through the left atrium, through the mitral valve, into the left ventricle, which then is going to go up through the aortic valve and through the aortic. Now we have some of our veins. We're going to have our carotid artery and jugular vein. We're going to have our thoracic aorta. Off of that is the hepatic artery. We have the renal artery, the abdominal aorta, common iliac artery. Then we're going to have the iliac vein. We have the renal vein, the gastric vein, and then up here in the arms we have the basilic vein and the bronchial vein. Now we have our capillary. Over here we have our artery, then our atrial. This is our capillary. This is where oxygen and nutrients go into the cell. Waste and carbon dioxide come out of the cell from the venules, which are attached to our vein. Now we're going to talk about conditions and their effects on the cardiovascular system. Many different congenital heart defects cause different things. That means defects happen to a child when they're still in their mother's womb. I had tetralogy of flow, so that's what I'm going to speak on. Tetralogy of flow, like I said, is a congenital heart defect. It can happen in 4 different ways. That's going to be pulmonary valve stenosis, which is a narrowing of the valves of the heart and lungs. There's a hole in the bottom of the heart chambers called ventricular septum defect. That is what I had. I had it repaired. There is the shifting of the body's main artery. That's going to be your aorta, which affects, like the other ones, it's going to affect your blood oxygen levels, and it's very difficult because then it's causing damage to your body tissues and your heart and your brain because they're not able to perform cellular activities, which causes cell death. So without oxygen, they're unable to metabolize and get that nutrients from the blood and send back waste. In a nutshell, we also have the thickening of the right lower chamber of the heart called ventricular hypertrophy. But yeah, some risk factors with that are going to be family history, having rubella during pregnancy, drinking alcohol, smoking, eating poorly, being older when you're the mother, and then having Down syndrome. If the mother has Down syndrome, it's more likely for them to have tetralogy of flow. If the child has Down syndrome, it's more likely for them to have tetralogy of flow. My next condition is going to be tachycardia, which is when you have a consistent beats per minute of 100 or more. The main risks and complications of this are going to be blood clotting, fainting, heart failure, and sudden cardiac death, which is very unfortunate. Some of the symptoms are going to be fatigue, feeling lightheaded, fainting, of course, nausea, things like that, just from the pure rapid heartbeat, which you're also going to be experiencing. And it can be extremely difficult if you're an active person because adding that cardiac stress onto an already stressed heart can be very difficult for the athlete or patient.